The use of mebendazole plus ivermectin repurposed used in cancer, results of a new trial with some questions. Hi there, my name is Dr. Walter Lemo, naturopathic physician with a practice solely focused in cancer care for over 20 years and in clinical practice for 27 years. So April 7th, there was release of a prospective observational trial using ivermectin and mebendazole, the antiparasitic, off-label in cancer. And so I received some attention on my news feed, and some patients were forwarding me some of these results. And obviously when you look at the title of the results, the clinical benefit was 84.4% and 48.4% reported strongest positive outcomes consisting of regression and no evidence of disease. So obviously those sound really good and really encouraging. So just to tell you, so for me, when I was just briefly looking at this data, it's really hard for me to kind of say much about it. The reason being is that it was largely a self-selected group, so it was provided via telemedicine, and this was like a self-reported like surveys and assessment looking at a whole group of cancers, so like prostate, breast, colorectal, even some lesser amounts of pancreatic, melanoma. So it was a big group. So they looked at, I guess, 197 people, and 122 completed the survey. And they also did levels of conventional treatment. So there were surgeries there, it was chemotherapy, there was radiation, there was immunotherapy, there was hormone treatment. So it's kind of this hodgepodge, that you're kind of trying to make heads and tails out of it, right? And then they did report like there were some side effects. So they reported, 25%, 31 of 122 patients reported some side effects. Most frequently were gastrointestinal, 38.7%, some fatigue, dizziness, skin reactions, and 12.9. So, that's something that potentially could be learned. So at the end of it, it's, you're looking at these results and it's like, well, like how much of this was related to the conventional treatments, And then this group, again, was like very motivated. So they were into like supplements and other things. So for example, they could have been like patients like mine who are doing stuff with me, and someone else. And they could have been doing vitamin C IV as an example, and mistletoe and everything else. So it's really hard to kind of pin this group down. And so me looking at the results, it's like, okay, it doesn't look as impressive for me. Obviously, it looks like nobody died. It wasn't like any serious of the side effects. When you look at those side effects, like, every one of them could relate it to chemotherapy, for example, like, from what they've received in the past or they were receiving concurrently. So I would say, and then the other part to mention is that there was conflict of interest. So they're all funded by the wellness group, the group that provided the telemedicine, that's funding salaries, that's providing the ivermectin and mebendazole. And I know with pharma drugs, there's always conflicts of interest as well. So that's why I'm not as there's conflict of interest. Like, look at all the pharma drugs out there. There's always conflict somewhere. But so for me, the take home is like, okay, this was published, it's out there. And as the authors state, more information, better trials required. But it's hard to kind of like really understand what those numbers mean, other than this self-selected group who's, quite motivated to try these things. Maybe they did okay. And so anyways, more to come, but hopefully this helps to answer some of the questions that are published out there. Being discussed out there.